Do you always feel like you have to go to the bathroom, but you've been told that it's not a UTI? Here's what it could be instead. Okay, I'm done. Have you experienced the urge to pee more than you feel like is normal? Are you always making sure that you go to the bathroom as soon as you get to a place and you go before you leave because you don't know if you're gonna be able to make it to the next bathroom? And yet you've gone to the doctor and you've told them of these symptoms and you've said, I think I have a UTI, and they've tested you and they've said, you don't have a UTI. What are you supposed to do? Where's the answer? Where do I go from here? Well, I'm gonna tell you. You can also have UTI-like symptoms if you have tension in the front of your pelvic floor, all right? So I am Dr. Christina, the Picky PT, and I'm going to tell you about your pelvic floor and how you can be picky with which parts of it you're turning on and which parts you're turning off, all right? So I want you to think of your pelvic floor as a front and a back, all right? And the center of your pelvic floor is divided between your sit bones, all right? The ones that when you're sitting down, you feel those bones underneath your bottom that are digging into the surface you're sitting on. Those are your sit bones, and right between those is where we're gonna divide the pelvic floor from front to back, all right? The front of your pelvic floor is responsible for letting go of urine and includes, the birthing canal. The back of your pelvic floor is going to include your glutes and include any of your muscles that are responsible for having a bowel movement. So when people are having that urgency to pee and they feel like it's maybe a little tight, maybe a little burning when they pee, those are classic signs of muscles tensing around the urethra in the front of your pelvic floor, causing those symptoms for you. So how do we turn that off, all right? I'm working with a client right now who actually has some issues, and the cues that I've given her is when you're sitting on that toilet, okay, you're gonna go ahead and make sure to pull your lowermost abdominal muscles in, all right? This means below your belly button. The abdominal muscles that are below your belly button. You're gonna pull those in, shifting your weight from on top of your thighs to right on top of your sit bones, okay? And then you're gonna imagine kind of corkscrewing your hips or your knees in towards each other, engaging those adductors. Feel how that spreads those sit bones apart from each other and releases tension in your pelvic floor, all right? If you can do this, then you'll be able to release a whole lot more urine anytime you go to the bathroom, reducing the tension and the urge incontinency. But if you practice these exercises, this position as you're sitting in a car, at a desk, you're sitting in a chair, this can also help you to keep the front of your pelvic floor muscles relaxed and not let them tense up, giving you that urge incontinency again, okay? So for a different view, what I'm asking you to do when you're sitting on the toilet or when you're standing outside the bathroom and you're trying to hold your pee a little bit longer is you're gonna wanna go ahead and pull in your lowermost abdominals, okay? Not just your belly button abdominals. I want you to pull in your lowermost abdominals while also corkscrewing those legs in, making the back of your pelvis a little bit wider and looser while you hold those abdominals at the same time. We're taking the pressure off of the front of the pelvic floor and shifting it back. From the side, what that would look like is pulling those lowermost abdominals in, all right, while corkscrewing in those hips and relaxing the back of your pelvic floor so that you can hold your urinary incontinence a little bit longer, so you can make it through that line while you're waiting for the bathroom, and so you can make sure to expel all of your urine when you go to the bathroom. So if you try this sitting on the toilet, like we said, pulling your lowermost abdominals in, shifting your weight back to your sit bones, corkscrewing those hips in and squeezing those thighs in towards each other, and you don't feel like that helps with your urge incontinency or your ability to release urine, then please see a pelvic floor physical therapist. We would love to assess you and make sure that you're getting personalized treatment for your personalized issue. If you try this tip out and you find it helpful in the bathroom, please share with any of your girlfriends that you've gone to the bathroom with before to gab. Go ahead and gab about this with them and how they can help themselves become more independent and confident in controlling their pelvic floor.